Hi, my name is Dr. Jesse Liu. I'm a practicing dermatologist, and this talk is about how to differentiate using the topical steroids. Topical steroids are pretty much the most useful thing that we can use to treat skin conditions. And so if you know how to use them well, then you probably are able to treat at least half of the skin conditions that we typically treat. But their main side effect is that they can thin the skin out. And what do I mean by this? So if you take a look at this picture, you can see that there's discoloration of the skin, that the blood vessels are a little bit more visible underneath the skin, and that there's also a textural change. It almost looks like there's a crinkled type of appearance on top. And higher potency topical steroids have a obviously higher risk of thinning the skin, so being careful about which topical steroids to use in which areas is an important part of your arsenal on how to treat things appropriately. So first, let's start basic. Let's do just the three most common topical steroids in terms of high, middle, and low strength. So for your highest strength, you have Clobetasol. For your middle strength, you have Triamcinolone. And then for your lowest strength, you have Hydrocortisone. So just the three again: Clobetasol, Triamcinolone, and Hydrocortisone. If you take nothing away from this talk, just remember those three. But let's be a little more sophisticated. So there's actually 7 strengths of topical steroid, number 1 through 7. And let's fit in those previous 3 medications within the scheme. So again, those are Clobetasol, Triamcinolone, and Hydrocortisone. But what about in between? So class 2, you've got Betamethasone-Dipropionate, and then a second one as well, Fluocinonide. For class 3, you've got Mometasone, and then skipping over Triamcinolone again, and then class 5, you've got Desonide. Class 6, you've got Fluocinonide. So let's talk about each of these in a little more detail. So first, Clobetasol. So again, this is the highest potency topical steroid. You pretty much want to avoid using it for longer than 2 weeks. Generally, you want a dermatologist to be the one who's prescribing this. And these are also generally safer on thicker skin. So for example, the palmar plantar surfaces, including the palms and soles, and the scalp as well. Next, you've got Betamethasone-Dipropionate. And for betamethasone, you just want to be careful. So there's actually 2 different types of betamethasone. So just be careful of the suffix. For Betamethasone-Dipropionate, just think of the di being the prefix for 2. So that's class 2. And then for Betamethasone-Valerate, it starts with a V. That's the Roman numeral for 5, so just think of it as class 5. In reality, it's between class 3 and 5. But either way, Betamethasone-Valerate is weaker than Betamethasone-Dipropionate. Betamethasone can be generally thought of as a good stepping stone above Triamcinolone. So when Triamcinolone fails, then for the primary care doctors out there, Betamethasone would be a good step to go to before you reach for Clobetasol. Now, this is one common pitfall with betamethasone. It's actually formulated as Lotrozone, where it's combined with clotrimazole. And in those cases, just be careful. So clotrimazole is an antifungal medication, and it can be used to treat tinea and other fungal infections. But just think of where tinea typically happens. For tinea cruris, if it's in the groin, that is not a safe area to use a topical steroid such as Betamethasone-Dipropionate, which again is class 2. So just remember, I would not use Lotrozone in the groin if you don't know what you're treating. And as a reminder, high-potency topical steroids don't belong in intertriginous areas. Now moving on to 2 new topical steroids. Let's just combine these 2 since they sound so similar. Fluocinonide and Fluocinolone. So I just remember this because Fluocinonide, the last 4 letters, almost contains the letter high, or the word high. So Fluocinonide is class 2, and the brand name is Lidex, which also sounds similar to high dose. Fluocinolone is a much weaker topical steroid. It has almost the word low in it, so that one is class 6. That one is branded as Dermasmooth, and that's an oil that you typically can use in the scalp. So these 2 actually have some things in common, in addition to their name. Both are useful for scalp conditions, and sometimes they're actually denied by insurance. Now moving on to class 3, Mometasone. This one's kind of boring. You just remember the M being a letter that looks similar to the letter 3, so it's class 3 steroid. I don't tend to really use it that much just because it tends to be denied by insurance. And then moving on to class 4. So this is your mid-strength, this is your bread and butter, Triamcinolone. And with Triamcinolone, it is a class 4 topical steroid like we talked about, but this is the only topical steroid where your percent matters, so just pay attention to the percent that's afterwards. So the most common Triamcinolone is just that class 4, 0.1%, but there's also class 3, 0.5%, which is often easier to get than Mometasone. So I typically end up prescribing Triamcinolone 0.5% whenever I normally think of prescribing Mometasone. Now, as far as Triamcinolone 0.025, that's the weaker version of the regular Triamcinolone, and that's class 5, just one step down. And I think of this as an alternative to Desonide. And just one other tip with Triamcinolone lotion is a cheap topical steroid for the scalp. So if you're in the situation where you would have prescribed the Lidex solution, or Clobetasol solution, or Fluocinonide oil, and you couldn't have gotten covered by insurance, then maybe you want to use Triamcinolone lotion. Now moving on to Desonide, another boring one. Desonide has a 5 in it if you think of the S. And like I said before, I typically end up prescribing Triamcinolone 0.025% instead of Desonide. Same reason, it's typically done by insurance. Now we already talked about Fluocinonide, and moving on to Hydrocortisone. So this is your bread and butter weak topical steroid. And there's two types, 2.5% as well as 1%, but in this case, the percent actually doesn't matter. The 1% is available over the counter, the 2.5% is a prescription, but it actually doesn't matter because both are class 7. They're both the weakest class. So it really doesn't make a difference if somebody has already filled over-the-counter cortisone and they're coming to you and you give them a hydrocortisone prescription. That really doesn't do that much. This is safe for sensitive areas. So for areas that are higher risk for topical steroid side effects, such as the face, eyelids, armpits, or groin, hydrocortisone is one that you'd typically want to think of using. So just to summarize, there's 7 classes of topical steroids, and just if you want to take away anything, just remember the 3 most important ones. So those would be Clobetasol, Triamcinolone, and Hydrocortisone. Those are your strong, your middle, and your weak topical steroids. And to add more to it, you've got Betamethasone-Dipropionate and Fluocinonide. Those are your class 2. For class 3, you've got Mometasone, remember that 3 in it. And for class 5, Desonide, it's got that 5 in it. And then Fluocinolone, which is the lower version of Fluocinonide. And then Hydrocortisone is your weakest.